Many European countries have introduced new lockdowns or other similar strict measures, and it appears that Malta is only steps away from having to do the same. But what are quarantine and lockdown doing to our mental health? I'm now talking to psychotherapist Anthony Camilleri. Anthony, good morning. From a therapist's point of view, what has COVID-19 done to our mental health?
Good morning and thank you for this invitation. The outbreak of COVID-19 has brought some kind of uncertainty, which has led towards solitude and loneliness. This reality of experience, which is experienced not only in Malta but also felt in the whole world, is something which is really affecting the well-being of the individual. Basically, in psychotherapy, in the field of psychotherapy, what we do is we support the individuals to interact with the world around them. And what's happening is that there is this sense of boundary or block which is being created between us and which is not allowing us to interact with the world around us. So if I can refer to the socio-cultural interaction, it is something which has been lost, which is lost due to COVID. And this is bringing us face to face with social isolation.
Can you describe in detail what's happening to us in a quarantine or lockdown and what we can do to deal with such situation?
Humanity is all the time adjusting creatively to what happens. When we open our eyes, we have to adjust to whatever the day brings to us. And we creatively adjust to this either positively or negatively. So if I have to go into the experience of this or into the aesthetics of experience of this, we are being faced with a lot of stress, a lot of anxiety. We are seeing the issue of substance abuse increasing, the issue of domestic violence increasing, and of course depression. So the question is, or the answer is that we are not only dealing with loneliness, but we are dealing with existential loneliness, because every day we are seeing people in our families die, people that are part of our friend circle dying, and the answer to that is that we are lonely, but we are not alone.
Anthony, you are also the CEO of YMCA Malta, which has set up a loneliness response line back in March. Do you still receive any calls?
Yes, since the 23rd of March, when the loneliness response line was launched at YMCA, we have received over 770 calls. The highest reason why people call us is because of loneliness. In fact, we had over 360 something calls. The second reason then it's about family issues and domestic violence. As I said before, this is something which is increasing. In fact, we had around 170 calls. And then the third issue is mental health. We had over 120 calls which had to do with mental health.
Anthony, thank you very much for being on the show and for your time. Have a lovely day.
Thank you. You too.